the big problem is that doctors give you antidepressants directly when you tell them you are sad or have mood swings. In my case, the cause was the lack of testosterone. He's male, of course. I found out after the tests.
This is such a big bugbear for me, and this is something that you see and hear of all the time. Guys get put on antidepressants, which makes erectile dysfunction worse, which can make them more socially isolated, can damage and challenge relationships and things. And for me, like, you do a set of blood tests when often patients will have a set of blood tests done when they start going in with symptoms of low mood. Certainly women of a certain age would have a set of blood tests done just to check that there weren't any other causes. And this is a real opportunity to check these things. It's not an expensive test. But I do think that while it's not an expensive test, we tend to test for things that we know how to manage. And actually, a lot of the time, certainly in primary care physicians don't tend, and this is a broad sweeping statement, but as a general rule, they don't tend to feel comfortable managing testosterone deficiency. So I think that might be partly where the issue is. But I mean, even with people with, type 2 diabetics, we've got an absolute opportunity there to test for testosterone deficiency, because we know that, 40% of type 2 diabetics will develop testosterone deficiency, and, start looking out for it. They're having regular blood tests anyway. And it's such an easy and really satisfying thing to treat. When you treat it early, it keeps, it treats the depression far better than an SSRI, which has limited evidence for anyway, and will, as I said, create even more side effects for that individual, and won't get people back on their feet and back to living good, happy lives nearly as fast, or if ever, as normalizing someone's testosterone for them. So yeah, sorry, my little rant there.